while during depolarization, the cardiac muscle cells get stimulated by sodium flowing into the cell, and then this action potential kind of goes down like a wave. So sodium kind of flows in and causes that cardiac muscle contraction. But this is only the electrical event. So this is the electrical event from the positive and negative charges that are expected to cause a mechanical event, and the mechanical event being the contraction here. Now, there are certain dysrhythmias where there is an electrical event, but it's not causing the contraction, and that would be PEA, also known as pulseless electrical activity, which is why we learn in basic CPR class that we always have to check the patient's pulse when they become unresponsive. Because on the EKG monitor, we might see a waveform. We might see this electrical activity, but because no contraction is happening, we are not able to feel a pulse. So this pulseless electrical activity, electricity is flowing through the heart, but it's not stimulating these muscle cells, and therefore the patient doesn't have a pulse, there's no circulation, and then certain measures will have to be taken. And this depolarization here on an EKG, the P wave represents atrial depolarization, and the QRS complex represents ventricular depolarization. So the contraction of the atria comes first, followed by the contraction of the ventricles, and of course the ventricles are going to be stronger, have a stronger and longer contraction because they are much bigger, and they are the ones that produce the cardiac output.